We were talking about the NFL injury report, which came out just a few hours ago. Coincidentally, we were already planning to talk to Dr. Al Johnson, who's a doctor of internal medicine with a special interest in the area of chronic illness, allergy, and environmental medicine today. The Hyperbaric Center of Texas.com is his website. We were going to talk about CTE, head trauma, the death of Tyler Sash, and now we have more information from the NFL. Dr. Johnson, good afternoon.
Good afternoon.
I don't know if you heard these numbers yet. The story just came out a little while ago, I think around 1:30 or 2 o'clock. 271 concussions reported by the NFL last year alone in 2015. 234 of those in games, which is more than any other year in the NFL, even though they've been pushing for safer contact in the sport. You find that interesting, as I do?
Well, it is interesting. It's not surprising because they're much more vigilant about assessing players, paying attention to each hit and how the players are coming off the field, and they're recording it. So I think that's good news in the sense that they're picking them up, monitoring them, and then not allowing them to get back until they're ready to.
Yeah, that's kind of the same conclusion Shaggy and I came to, is that the NFL is trying to do a little CYA and protect themselves, so they're making sure that any possible concussion is checked out, and if you might have something, you go through the whole protocol. So that's why the numbers have gone up, not because they're more concerned about the players, but that they're more concerned financially about any damages that might be done and liability in the future.
Well, yeah, and I think it falls back, though, that it is protecting the players in the long run, because the players are realizing that, yes, this can happen. My employer is attuned to it, and we need to be as safe as possible.
This story has taken a special interest with the movie that Will Smith has been in this year, Concussion. I haven't seen that yet, but I hear it's a fantastic movie, and the story that doctor portrayed in the movie Concussion is quite an interesting story. And then back in September, a former safety for the New York Giants, Tyler Sash, was found dead at age 27, not directly related to any sort of head trauma, but an OD on pain medications, but CTE was detected in the autopsy. Explain what that is.
Yes, well, CTE is the end result of repeated traumatic brain injuries where the brain is affected and deteriorates. The result is in mood changes, difficulty with memory, difficulty with energy, with focus, and so in his case, he was unable to work. And he had mood changes. He's picked up by the police. He was on pain medicine, and when your brain's not working well, you don't realize how much you're taking. And so the overdose situation is not too far-fetched in that area.
Is it unusual for someone that young, 27 years old, to be so susceptible to head trauma, to CTE at that age? He was cut in 2013 by the Giants after 5 concussions in that season, which seems like a lot. I'm no doctor, but I think that might be a little bit of a problem.
Yeah, that's quite a few. But when you look at how players are in the NFL, it would not be unexpected. He may be one that's just more susceptible to the injury pattern. It is unusual to see someone that young, but they haven't had that many young players that have played football on a repeated basis die where they can do an autopsy and find out what's going on with the brain. I see patients all the time that have had concussions, and then they have post-concussive syndrome where they continue to have headaches, memory problems, fatigue. In fact, there's a doctor that fell and just hit her head on the first time, and 6 months later she's still unable to go back to work. And on these patients, the only thing that really heals the brain is hyperbaric oxygen. All the rest of it is helping the brain recover, rest it, give it time. Hyperbaric oxygen actually supplies oxygen to the brain at 10 to 15 times normal. Oxygen is the main nutrient, and so those cells that have been damaged can heal. and then people get back to normal functioning.
And that's
So
what do you do there at the Hyperbaric Center of Texas?
Exactly. And so it's real exciting when you see somebody that's been tried to recover, and then you can help them recover when they haven't been able to.
Now, are these hyperbaric treatment facilities available around the country, and how can you gain access to one? Because I know that there are a lot of parents. We've talked about this subject several times when stories like this are in the news. And we've talked with the University of Toledo Med Center, Dr. Saparsky at UT about injuries to kids in the area as a result of, say kids who are specializing in pitching and wind up destroying their arm in the future. Are hyperbaric facilities available to elementary high school kids who are playing football and might get hit, and have parents who are concerned about the long-term effects of a minor concussion?
Well, they really aren't readily available because the use of it for head trauma is an off-label use. In other words, the FDA does not license hyperbaric chambers for that use. However, since they're licensed chambers, physicians all the time use unlicensed areas of treatment for medications as well as the hyperbaric chamber. So you'd have to look for a freestanding hyperbaric center, which is what I have. The hospitals have it. They use it mainly for wound healing.
These are these metal chambers that you can lie in and just do nothing but inhale oxygen, right? It seems like I've seen this on an episode of House before.
Exactly. They're a metal acrylic enclosed chamber where you increase the pressure 1 to 2 atmospheres above what you normally breathe, which then increases the oxygen flow to the tissues by fully saturating the whole blood vessel, not just the red blood cell carrying oxygen.
How does that differ from just getting oxygen treatment on the sideline?
Well, just on the sideline, it saturates the red blood cells, and the red blood cells then are able to carry a little more oxygen to the tissues. But the hyperbaric oxygen increases it 10 times.
So the oxygen is good, but if you can get hyperbaric treatment, that's even better.
Exactly, and it's accumulative in its action, so that just one treatment doesn't do much. It's like exercise; you got to do it on a repeated basis. So it's a therapy program where you need to go through, 5, 10, 20, or more hours. We treat stroke, and that takes a lot of times 40, 80 hours of treatment. There's been studies done on veterans with traumatic brain injuries, and the pilot studies showed that 80 hours of treatment got 80% of the vets back to some functional use that had traumatic brain injury.
I remember when the Indianapolis Colts, where I lived before moving here to Toledo, they drafted a wide receiver named Anthony Gonzalez, and I remember him being ridiculed because he has some sort of oxygen chamber tent set up in his bedroom where every night he sleeps in some sort of oxygen tent.
Well, exactly, and those are soft-sided, quote, hyperbaric chambers. They're actually mountain rescue bags where you get increased oxygen with a little extra pressure, which does increase the delivery more than just your normal red blood cells would. Terrell Owens here in Dallas did that.
You could make fun of it, but it appears to have some sort of benefit. Dr. Johnson, the Hyperbaric Center of Texas.com. Any closing advice for anyone listening who might have a kid or a grandkid playing football, playing a contact sport, signs of possible head trauma or a concussion, and what to do about that if you're afraid of any sort of injury to your kids?
Well, exactly. First of all, make sure that they're using proper equipment when they are participating in sports. If they do have a head injury or they're stunned or knocked unconscious, make sure you're following the protocol. If they aren't recovering, be sure to see your physician and make sure what's going on, because it can be more than just a concussion, and they need further medical advice.
There's a kid that our morning guy Fred Lefevre talked to yesterday, Suleiman Mustafa, I believe was his name. He's 19 years old. here in Toledo and has invented a technology using the polarization of magnets to implant that technology in helmets, and doesn't keep helmets from touching, but it helps absorb the pressure. So there is new technology along the way which may be able to help prevent future injuries. It may not be next year, may not be 5 years from now, but people are working on ways to keep these players in what we know is a dangerous sport a little bit safer, especially kids. Dr. I appreciate your time.
Thank you so much. And if you have questions, visit my website at Hyperbaric Centers of Texas. There's other information there.
Fantastic. Thank you so much.